Hi everybody, Mike the PT, your physical therapist for your limb lengthening journey, okay? One of the many questions that I get asked is what should I be doing before surgery, okay? How much stretching, how much exercising? Is there a balance between both, and should I be doing both? The answer is yes, you should be doing both, exercising and stretching. And the reason I say that is the better you go into surgery, typically, the better you come out of surgery. So what we're going to do is, I want to show you first what the doc is looking for, right? So when you ask, what should I be doing? What kind of stretches and what kind of exercises should I be doing? Well, let me show you basically what the doc wants to have you do, or what he's going to be looking for upon your examination. So what we're going to do is, I want to show you first what the doc is looking for, right? So when you ask, what should I be doing? What kind of stretches and what kind of exercises should I be doing? Well, let me show you basically what the doc wants to have you do, or what he's going to be looking for upon your examination, okay? So the first thing he's going to do is look at your hamstring length and then the measurements in your knee, okay? So come on over here, I'm going to lay down on this table and show you kind of what I'm talking about. So the first thing that the doc looks for is what's called the hamstring length. So it's the popliteal angle, which means the angle between your hamstring and your calf, okay? So what we do here is, you're going to lay straight, you're going to bring your hip to about 90 degrees here. When you hold the back of your leg like this, and you're going to just lift your leg up straight, okay? You can kind of see how I'm starting to shake just a little bit right here. The measurement right here, or from vertical, should be about 0 to 20 degrees, all right? So you're going to stand here and you're going to go, all right, if at 90 degrees, my knee is almost extended fully, you're in a good position. If you're super tight right here, that's going to be something that you're going to want to work on, okay? Compare both sides, hip to 90, straighten out, okay? I'm a little tighter on this side, it feels like, okay? So as we're trying to measure right here, okay? That's the first measurement, okay? Hamstring length or popliteal angle, okay? The second thing is just knee range of motion, okay? So you're going to pull down through here. Your heel should be dang near touching your butt, all right? That's just the ability for your knee to flex fully, so that the length, and we're looking for the length of the quad and the motion in the knee, okay? All right, this next thing, and let me grab something real quick for you. So this is the third measurement, okay? So we did hamstring length, knee range of motion on your back, and then doc's going to look at knee range of motion while you're laying on the table, okay? So I'm going to use this strap to demonstrate for you. So come back to the table. So I'm going to put this on my foot, okay? All right, so now I'm pulling, okay, my heel towards my butt back here, okay? So as I'm pulling this back right here, I feel a stretch on the front of my quad, or the front of my thigh, but I'm checking to see the measurement of the length of the quad by measuring the knee angle. Basically, the standard is get your heel to your butt, all right? Heel to your butt, and then you're good to go, okay? So there's the three measurements that you need to be taking prior to surgery. That's what the doc's going to do on your assessment. It's what we're going to be challenging you in physical therapy, and the better you are with those three measurements going into surgery, the better you come out. Hamstring stretching, and we're talking about stretching in general. you don't have to go to yoga if you don't want to. If you're a yoga person, go to yoga and enjoy it. I don't, so I don't go to yoga. So I want to show you a stretch that I'm not a big fan of. With a stretching strap, people will kind of lay down like this, okay, leg out or leg bent, but they're going to take their leg and they're going to stretch it up like this. Now, don't get me wrong, I do feel a stretch in the back of my leg, but I also feel burning in the back of my knee, all right? This exercise is done wrong so many times. The reason it's done wrong is, well, one, I'm doing a nerve stretch. I'm not even getting to my muscle, okay? So that's a little tighter, a little bit more nerve, okay? If you want to stretch this way, you got to come out to the side a little bit and pull forward until you're feeling the hamstring muscle. You shouldn't be feeling burning in the back of your knee, okay? That's the first thing. Not my favorite exercise. So, if time is difficult or, resources aren't always there, a long sitting position I'm more favorable for. On the floor, on your bed, on your counter at home, I don't care, okay? So in this position, okay, square up, and you're going to reach forward like you're trying to get to the toes here. So I'm stretching and I'm getting a little bit of a bounce in my foot and I know I'm getting some work. This is exponentially better than that laying on the back, pulling your leg into the air exercise. Don't do that one. This is preferred. Now, the best exercise to get the hamstrings to work is active movement, okay? So when we do active stretching rather than static stretching, we can tend to get a little bit more of a muscle stretch by using our brain and nerve ability, okay? All right, here's what I mean by that. If we wanted to increase our ability to touch our toes, right? That's one method that we use to stretch, right? We touch our toes, okay? If touching our toes is difficult, what you can do is bend your knees, and now from right here, touching your toes, stand up, okay? We call that a reverse toe touch, right? So I'm already touching my toes, knee bent, but now I'm going to stand up straight, okay? And same thing, I'm going to feel it in my hamstrings, my glutes, not behind my knee, and it's not going to be a nerve pain. After I do that, my range of motion will increase, all right? So, reverse toe touch. Lastly, I like to do an exercise if you have the resources and if you're capable of doing it. So, come over here, I'll show you. All right, we got the rack, we got the Olympic bar here, okay? Deadlifting, okay? Or resisted, okay, toe touching, right? Or with weight assisted, right? As opposed to resisted. So what you do with the bar is, okay, from here, and you can have weights on it. This bar, it's got a relative weight to it, so I can use it. I can go shoulder width apart, okay? And I can push my butt backwards, like I'm trying to shut the car door, okay? Push backwards and drop down, okay? As I'm here, I'm feeling a comfortable stretch on the back of my hamstrings, okay? And then I return, okay? Push back, I'm on my heels, pushing backwards, and then driving back up, okay? Deadlift. Do not do this with a lot of weight. You can do it with dumbbells, you can do it with barbells, you can do it with kettlebells, or you can do it with an Olympic bar, okay? Push your body back, down, and then back up, all right? So there are 3 exercises that you can do for your hamstrings to get you ready for your limb lengthening procedure.